Hi everyone, I'm Varsyni, a visiting clinical psychologist at Seed Autism Malaysia. I'm here today to talk a little bit about what is autism, some of the signs and symptoms of autism, some of the red flags you should be looking out for as parents and caregivers, as well as who are the healthcare professionals that can aid in helping with screening and diagnosis of autism if you do notice some of these symptoms. So, if this sounds like something that you're interested in, keep on watching. So, autism or autism spectrum disorder, ASD, is a developmental disorder that affects how people communicate as well as interact with each other. The signs of symptoms of autism can vary widely, but some common ones would include impairment in social communication, social interaction, just a social skill deficit. So they might have difficulty with engaging in conversations, making eye contact, and as a result of this, they may have difficulty in forming as well as maintaining relationships. The second one would be a restricted repetitive pattern of behavior as well as interest. So they might engage in repeated behaviors such as rocking their body like back and forth like this, or flapping their hands, or even repeating certain words and phrases. And also because of their restricted pattern of interest, right, they might obsess over a particular topic, they might talk about it excessively or spend an abnormal amount of time in it. The next one would be sensory sensitivity. So generally, people with ASD may have some level of sensory sensitivity. So they might be bothered by certain textures like sounds or having difficulty with sensory integration. So just to give you a little summary of what I just told you, essentially ASD can be defined with two main characteristics, one being having restricted repetitive pattern of behavior and interest, the other one having social communication deficit. These are the two hallmark criteria. Okay, so now what are some of the red flags parents should be looking out for in relation to autism? As ASD can present itself with a range of symptoms, it can be challenging sometimes for parents to identify the early signs of the disorder. So I'll explain the way these symptoms may be manifested in a child, which may indicate the need for further evaluation. So the first one would be delayed or absent social communication. So this includes responding to their name or engaging in back and forth conversation. So when there's a lack in this area, this is a cause for concern. And then there's a lack of interest in social interaction. This means they may not seek out social interaction with their peers or adults. Thirdly, it will be repetitive behavior and interest. So they may engage in behavior such as lining up objects. So this means, let's say the child is given a toy and it's a train track that they're supposed to piece it up together and then place the train over it. Instead of doing that, they may just line up the tracks just right next to each other, each pieces right next to each other into a straight line. So this would be a repetitive behavior, and they might do this with other toys as well. And next would be sensory sensitivity. So they might have heightened or diminished sensitivity to certain sensory inputs like noise, touch, or light. So they may appear to show dislike or even be afraid of certain noises like bells or dog barking. These are some examples. Next would be delayed or atypical development. So, generally, children with autism may show delays in reaching developmental milestones such as sitting up, crawling, or even walking. Or in some cases, they may even skip a particular developmental milestone. So, they may not crawl and just start walking straight away. They may also have difficulty with motor skills like running or jumping. And next, they'll have difficulty with change or transition. So, they may have difficulty with unexpected change in routine or transitioning between activities. And finally, it will be unusual language development. So they may have a lack or limited speech. They tend to repeat certain words or phrases, or they tend to use language in a very scripted manner. Finally, it's very important to take note that not all children with autism will display all of these red flags, and some of children without autism even may exhibit some of these symptoms. So if parents have got concerns about their child's development, they need to seek out evaluation from a qualified healthcare professional. In Malaysia, some of the professionals qualified to screen, evaluate, or provide a diagnosis for your child is a developmental pediatrician, child psychiatrist, and clinical psychologist. So all of them can play a role in diagnosing autism, but obviously each bring a different set of skill and expertise to the process. So here are some ways in which a clinical psychologist will be well suited for this role. One is expertise in psychological assessment. So, generally, clinical psychologists have specialized training in administering and interpreting standardized psychological assessment tools, which can be helpful in diagnosing autism and to evaluate a child's development in multiple domains like language skills, their social skills, their motor skills domain. And also it can help in ruling in or ruling out any other comorbidities. So some of the standardized psychological assessment tools are things like CARS, ADOS, MCHAT. These are probably some of the tools you guys have heard about. Next is familiarity with a range of interventions. So, clinical psychologists are generally trained in a range of interventions for children with autism specifically. So, this can include behavioral interventions or social skills training, and this familiarity with intervention can help them make appropriate recommendations for treatment as well as support. Next is emphasis on the child's unique strength itself. This is because clinical psychologists typically take a strength based approach to assessment and diagnosis, which means that they focus on the child's strength and abilities as well as the challenges. So, this approach can help to identify the child's unique needs and strength, and this can help to guide the recommendation for intervention. So, the treatment recommendation is formulated based on the child's unique strength and weaknesses as well. Okay, next it will be the ability to provide ongoing support beyond the diagnostic process. So this support can include therapy, counseling, guidance on navigating the education system, and accessing appropriate services. And next, it'll be monitoring progress over time, because clinical psychologists generally can monitor and track a child's progress again using standardized assessment tools and psychological evaluations. This can help to ensure that the child is receiving appropriate intervention and that their development is on track. So let's say you've enrolled them for an early intervention program and you'd like to know how effective it is. You can keep track of this using a clinical psychologist. They'll be able to provide you a report on what are their progress exactly. So this is to make sure that your child is receiving the best possible treatment. It's important to note that early detection and intervention are critical for children with autism, as early intervention can help improve outcomes and promote optimal development. Feel free to contact us at Seed Autism Malaysia if you have any inquiries at all about doing screening, assessment, or intervention for your child. We're happy to assist in any way we can. If you like contents like this and would like us to make more videos on this topic, please let us know in the comment section below. And it always helps to like, share, and subscribe.